afternoon, and thank you for joining us for this community briefing on COVID-19. Joining me once again today is interpreter Margie Prop, and thank you again, Margie, for being here. Today, we extend our sympathy to the loved ones of two members of our community whom we lost to COVID-19 this week. One was a woman in her 60s, and the other a gentleman in his 70s. Both were hospitalized. We have now lost 23 local residents during this pandemic, and as a community, we can honor their memory by rededicating ourselves to our efforts to protect one another during this pandemic. At this time, we do not have any details on the state penitentiary inmate who passed away in Lincoln. The state will conduct the investigation. The cause of death has not yet been determined, but he had previously been diagnosed with COVID. Once the investigation is complete, he will be counted as a Lancaster County COVID-19 death if that is, in fact, the cause of death. Please continue to do the good work you are doing to keep yourself, your friends, and your neighbors protected, safe, and healthy during this pandemic. Thank you to all of you who are wearing your masks, washing your hands, watching your distance, keeping 6 feet from others. For more detailed information about COVID-19 and the resources available to our residents and businesses during the pandemic, we encourage you to visit our website at covid19.lincoln.ne.gov. There you will find a dashboard with the latest data about COVID-19, and we update that dashboard daily at about this time. At the website, you will also find our COVID-19 risk dial, a color-coded tool that communicates the risk level for COVID-19 transmission in Lincoln and Lancaster County. We update the dial every Friday, and for the third week, the dial remains in the mid-orange area. Orange, of course, indicates that the risk of COVID-19 transmission is high. So here's where we stand today. An additional 72 individuals in Lincoln and Lancaster County have tested positive for COVID-19. The total number of lab-confirmed cases is now 5,540. Our total recoveries identified to date are up from 2,180 to 2,204. As you know, our Health Director, Pat Lopez, is usually with us on these Friday briefings to give you an update and answer questions. Director Lopez was diagnosed with a sinus infection earlier this week, and she did the right thing. Because the symptoms of a sinus infection are similar to those of COVID-19, she got tested. Tuesday night, she found out that she tested positive for COVID-19. Director Lopez has worked tirelessly behind the scenes to keep our community safe. While she has taken all the recommended precautions to keep herself well, Director Lopez, in her very demanding role, has not been able to work from home. And this is yet another reminder that all of us are at risk of exposure to this extremely contagious virus when we are out and about. We have the best chance of beating this virus and staying well if we all stay home as much as we can, wear masks, watch our distance, and wash our hands. We certainly wish Director Lopez well, and we look forward to her return to work. In the meantime, the public health of our community remains in the very good hands of our experienced and caring health department team. One of those key team members is Scott Holmes. He's the manager of the Environmental Public Health Division. He's been with us here before, and today he will provide more information about the indicators that have determined the position of the risk dial. Over to you, Scott.
Thank you, Mayor. In determining the level of risk to the Public Health Department uses local information about what is currently happening in the community within 3 weeks in 5 primary areas. So far this week, we have 396 new cases reported. Last week, we saw a new weekly high with 692 cases reported. Over the last few weeks, we've seen our numbers increase mainly due to students returning to local colleges and universities, as well as cases in the state correction system. As we know, college-age students don't stay on campus. They live, work, and socialize throughout the community. So our main concern is that the cases among this age group will spread and impact older adults who are more likely to have more severe illness. Unfortunately, our data indicates that this wider community spread of COVID-19 is happening. This chart shows the percent of positive cases by age group over the past 3 weeks. from the week ending August 29th to the week ending September 12th. The area in light gray depicts ages 18 to 19, and the area in yellow depicts ages 20 to 22. On the left side of the chart, you can see that these age groups made up 55% of the cases at the end of August. Moving to the right, you can see the gray and yellow areas have gotten smaller. Nearly all of the other colors that represent age groups have gotten larger. The light gray area, 18 to 19-year-olds, decreased from 33% to 16%. The green shaded areas, which represents 25 to 29, increased from 3.5% to 9.2%. The dark blue area just above the green is the 30 to 39 age group, which increased from about 7% to 14%. The brown shaded area is the age group 40 to 59, which has increased from 14% to about 18.5%. And the dark gray area at the top represents the 60 to 79 age group, which has increased from 6.5% to 12%. With this kind of community spread now occurring, we cannot let our guard down. We also want to share the 7-day rolling average that shows the rapid increase in daily cases that began in late August. This data allows us to more easily see the trends rather than just the daily fluctuations. This week, we're beginning to see the average cases per day level off. We also want to update you on cases connected to the state corrections. As of last week, 89 prison staff had tested positive, and 185 inmates had tested positive for the virus at the Nebraska State Penitentiary and Diagnostic and Evaluation Center in Lincoln. On a somewhat encouraging note, the average weekly positivity rate has stabilized, and so far this week, the rate is 11.7% after being up around 13% for the last couple of weeks. Nearly 70,000 people have now been tested in Lancaster County, and testing remains widely available in the community. Over 5,200 tests were completed the week ending September 12th. This was a new high for the number of weekly tests conducted, and that can mainly be attributed to the increased testing on campuses and in the state correction system. So far this week, we have about 3,400 tests reported. After experiencing delays in receiving lab reports from the state last week, the turnaround time this week has decreased from 3.4 days to 2.7 days. About 70% of the lab results were received under 48 hours. While we have no control over the lab turnaround time, it is critical that there are no delays. The sooner the lab reports are received, the sooner we can begin investigations and contact tracing. This is key to preventing outbreaks and clusters. Our public health nurses continue to do an excellent job. They've been able to complete 88% of the investigations within 24 hours of receiving the lab report. The number of COVID patients in Lincoln hospitals has been trending higher the past few weeks. We're now seeing numbers hovering around 30. Today, 31 patients are being reported. 11 are Lancaster County residents, and 20 are from other communities. Again, the position of our risk dial is determined by multiple data indicators from the previous 3 weeks. This map shows how those metrics are plotted on color-coded risk areas. Toward the bottom left, you will see testing availability and contact tracing are in the green. Toward the middle, you will find the ICU availability in elevated yellow. Toward the upper right, we will see all of the metrics are in the orange shaded area. You'll find the location of the risk dial, represented by the blue square outlined in red near the mid-orange section, indicating, again, a high risk of the virus spreading in the community. As this pandemic continues, we're seeing how many normal activities can continue if we take the standard precautions we have all learned. Physical distancing continues to be effective, even among people wearing masks. Wearing a mask continues to be a foundational aspect of protecting others and yourself from COVID-19. And good hand hygiene can never be overlooked. We continue to see no clusters of cases from exposure in classrooms or in most workplaces. This shows us that the prevention strategies and mitigation efforts that have been implemented by our schools and universities and our businesses and large work sites are working. The transmission of the virus that we are seeing is happening with common social activities outside of school and work. This is the area where we can all do better. Let's make these activities safe by taking all the recommended steps to prevent the spread of this highly contagious virus.
Thank you, Scott, and thanks for everything you and your team are doing to help keep people safe. We've heard a great deal this week about the return to the capital city of one of our community's favorite activities, Husker football. And the news that Husker football will be played this year has been very welcome for the team, fans, our businesses, and our wider community. Our health department and UNL officials visit daily, and our health professionals have worked closely with the UNL athletics department over the past few months to plan for a possible season. Now, that coordination continues in earnest, and our educational outreach to businesses and the public will focus on how we can all enjoy game day in the safest way possible. As I said earlier this week, for the season to be successful, we need teamwork. And I can tell you that the teamwork between the city and UNL has been exceptional. UNL Chancellor Ronnie Green joins us again today with more information on how the university is working to protect the players and their families, the Lincoln community, and our Husker Nation. And we thank him so much for being here today and for his leadership throughout the pandemic.
Well, thank you very much, Mayor Baird. It's a pleasure to be here again today, and let me, on behalf of all the university community, also wish Pat Lopez well and hope she will be back to full health soon. She has been a wonderful partner in working with us, as the mayor has said, on a multi-time daily basis as we have planned for our re-engagement of the academic mission of the university this fall, and we wish her very well. Just a quick update from the university perspective before we speak to Husker Athletics here briefly. So as the mayor has said, as we have held our fall semester, we just ended today our 5th week of the fall term. We've been very pleased with how that has gone, from the practices that you have heard being put in place for our academic enterprise of distancing and use of facial coverings and hand hygiene and doing everything to mitigate risk, and we've been very successful in doing so. We have yet to have any transmission of a COVID case in our academic setting, and we're very pleased about that. We have seen over the course of this week, as our testing has proceeded according to the same rationale and protocol that we've had since August the 12th, a decrease in the number of cases, a slight decrease, and a slight decrease in the positivity rate of those cases, and we're pleased to see that happening. Our quarantines and isolation to mitigate risk, we also know are working, and we're very, very pleased about that. With that said, we did announce today to our campus community that we're very pleased to have added testing capacity in place now that will allow us, beginning on Sunday of this weekend, to be testing every day of the week for needed testing, as well as those who we are going to add in targeted ways to help us learn more about the campus and learn more about whether there is transmission occurring in the campus, including some level of randomized testing to give us further baseline data. So we're very pleased about that. That will begin on Sunday with an additional capacity of 1,500 tests available for the week that will help us protect our community and the community of Lincoln as well. Relative to Husker football, it has been a big week, and we are very pleased, as the mayor said, to be working toward the resumption of a fall football season for the Big Ten athletics. As you heard earlier, October 23rd, 24th will be the opening weekend of that season under very stringent medical protocols. The conference evaluated carefully what it would take for us to be able to have a clean field environment for our players, for coaches, for support staff. That has been put in place to allow practice to begin as early as the end of this month, September the 30th, to prepare for that season to open on October 23rd and 24th. We will be releasing from the Big Ten the schedule for that conference schedule early next week, so you'll be able to see what that will look like. It's being finalized as we speak, but we're very excited for our players, for the community, for the state, for us to be able to return to competition safely. With that said, the guidance has also been from the conference that the spectators in the stadium itself will be limited to family and staff. So it will be a restricted in the stadium event, but of course we'll all be able to tune in via TV and be able to see those games and be part of that as Husker Nation, and we're very, very pleased about that. We also have put into practice in planning for the season that we will not be hosting group events on the campus. So tailgating will not be allowed. To be safe for our community, to be safe for our campus, to prevent any spread of COVID-19, following university policy in the same way that we're operating for the fall term. So we're very excited, looking forward to that, looking forward to a return to Husker football, working hand in hand with the Lincoln-Lancaster County Health Department in planning toward that event, and we're looking forward to the 23rd of October. Mayor?
Thank you so much for that information and update, Chancellor Green. And we also want to extend our condolences to Coach Frost and his family, and to your Chief of Staff, Mike Zeleny, and the Zeleny family, and the losses that they have experienced this week. As our Scott said earlier, we know that we can return to some social activities safely if we follow the necessary precautions. Our health department has successfully worked with venues and event organizers to increase event opportunities in our community. And here are just a few that they've helped out with. The Lancaster Events Center has hosted drive-in concerts and a modified super fair. The expanded Lincoln Children's Zoo has continued to offer families the opportunity to see and experience animals from across the world. Pinnacle Bank Arena and Pinewood Bowl have hosted events. Star City BMX partnered with the Lincoln Chamber on a regional BMX event. The Hub Cafe and Soul concert series at Union Plaza is safely hosting about 250 people outdoors each week. And Nebraska was one of 24 states to administer a bar exam despite the COVID-19 pandemic. Sorry, Nebraska law students, you didn't get out of it. There are just a few, these are just a few of the events and activities happening across our community because of coordination with our health department and the implementation of safety protocols. We have made these events work, and we will make Husker football work. The next few weeks will be full of planning, coordination, and education as we prepare our community for kickoff. And the prospect of game day returning to the capital city has boosted the mood of many residents, and that includes business owners and managers who see revenues go up when the Huskers are in town. The pandemic has taken a heavy economic toll, of course, but we are starting to see some bright spots. A key figure for the city is the sales tax revenue that help fund our infrastructure and our government programs and services. The city's fiscal year begins in September, and we have received our sales tax numbers for the first month of 2020-2021, our fiscal year. Keep in mind that the figures we receive now reflect sales from July. Sales tax collections were up $693,000 over where they were the same month a year ago, and that's about an increase of 10%. Part of this increase is driven by vehicle sales tax collections that were delayed during the pandemic because of the shutdown and delay of the county treasurer's office. Still, this is welcome news as our economy begins to recover from the impacts of COVID-19, and we, of course, still have a long way to go. So thank you again to the leaders and members of our Economic Recovery Task Force. We're now working to implement their recommendations to help our business community and help kickstart our economy. And finally today, we recognize and honor that this evening marks the start of Rosh Hashanah, the Jewish New Year celebration. It's a time for prayer, reflection, and shared meals, and we wish our friends in the Jewish community a happy and healthy Rosh Hashanah. With that, we'll open it up for questions.
Mayor Riley at the Journal-Star.
Hi, Riley.
Hi. What does your staff kind of expect when football begins? And sort of, I guess I'm thinking to the parking services division. Will they be accommodating people who might want to still have the tailgate experience, even if they can't go to the game? Or what might that look like?
I think there's a lot of uncertainty about what game days are going to look like in the fall of 2020. How many people will, in fact, be present in our community coming from out of town that would require the parking services? How many people will come downtown as opposed to other stay at home? So we're still working through those plans, but we are doing everything we can to support the safe movement and activity of people in Lincoln during home games.
And as a follow-up, the current DHM does not have restrictions on sort of bars and restaurants, which may be where people choose to watch football outside of spacing, but the capacity restrictions.
I'm going to come back up and just review, but there are restrictions still on bars and restaurants. It includes, masking and the capacity and spacing you mentioned. We think that is actually just absolutely vital to continuing to allow reopening of our resumption of more normal activities that Scott spoke of. There's some foundational aspects to keeping some measures in place, and I'll let Scott review those.
Riley, do you have a more specific question or?
Yeah, sorry, I should clarify, since I guess this is broadcast, but yeah, of course there are spacing and masking requirements at bars and restaurants. But as far as capacity goes, is there any thought to tweaking the capacity or reducing capacity for bars and restaurants if they might be more of an option for these tailgaters to go to watch football?
Sure. Interesting question, Riley. As you know, Mayor promoted the Dine Out Lincoln, and that has expanded the capacity of many of our local restaurants and bars to allow some outside seating in places that were previously not allowed. We fully expect that there will be requests for special designated liquor permits and probably requests for specific areas to allow additional people to be near a bar or a restaurant that can serve food or drink to the public. So we'll be looking at that. We know that we have an events committee that has worked for years with downtown Lincoln events and community events that involves multiple agencies, and we'll be working with them, and we're on that team.
Scott, a follow-up in light of, or it's not related to that question, but has the health department operations, have they at all changed with Pat's diagnosis?
Pretty much no. We've been on the phone with Pat multiple times a day. She's doing well, so yeah.
Scott, Bill Schammert with 1011. A question about hospitalizations and schools. Have you identified any hospitalizations tied to either LPS or the university?
I don't have that information, Bill, but I believe the answer is no. But I don't have that information with me today.
Scott, Andrew Ozaki from KETV, and maybe Ronnie Green might want to answer this as well. What were you guys talking about if the Big Ten were to have allowed fans in the stands? What were you guys prepared to do? And is there still a possibility that you guys could push for fans in the stands?
Hi, Andrew. So we had certainly had initial conversations back in the summer. So in late July and early August, those were very preliminary. We hadn't gotten very far in them to a final planning stage when the original 10-game conference season had been proposed. So let me explain the guidance here of the Big Ten. The guidance is based on the medical recommendation of the medical committee of the Return to Competition Task Force of the Big Ten that developed all of the protocols for the return to competition. And one of their recommendations was that the games be limited to only family and staff for in-person in the stadiums to protect the communities in which the games would be played. So that was the recommendation that the board accepted and ratified in the decision to return to play, and it stands as that decision. Now, if we were to learn, the decision was put out that if things were to change, it could be reevaluated with the status of COVID-19. So that's the only possibility for that being allowed to change. That would have to be in concert with local health guidance, with the communities in which those games would be hosted. But the plan moving forward at this stage is no fans, with the exception of family and staff in the stadiums themselves.
And while you're up there, has there been any indication about the schedule being released on Nebraska and who we might be playing this fall?
Yeah, I mentioned earlier in the comments that schedule has not been released yet. We anticipate that it will be released early in the week. If it's a little earlier than that, don't get me wrong, it could happen this weekend, but I sort of doubt it. That we'll probably see it the first of the week. They're finalizing it with the TV partners currently, as you can imagine, with the revamping of their schedules. It will be an 8+1 season where we will have 4 home games in Lincoln, 4 away games for the regular season, and then after that is over, there will be a matchup across divisions for 1 game. So that's the plan for the season. We should get the specific schedule out early in the week.
And one other question, going back to the random testing. As you email the students and the faculty out, are they required to submit to a test, or how does that work?
Thank you for that question. It helps me clarify a point that I didn't make earlier, so I appreciate the question. So we will be doing, as I mentioned, a portion of that expanded capacity of testing will be applied to what I'll refer to as surveillance or opportunity to know what the background level of COVID might be in the general campus community across the board, all students, faculty, and staff across the UNL community. That will not be a mandatory testing. We will encourage a sample of people to take the test and hope that they will, but it will not be mandatory. We will strongly encourage is the word I would use.
We have a question from Ashley. She says, you mentioned the university will not be hosting group or tailgating events. Does this include non-official campus events? How will this be enforced?
I'm not sure what you mean by non-official campus events. Give me an example of what that would be. So the policy that we have in place is following health guidance. We are not having group events beyond a size that allows spacing and use of best practices for distancing and facial covering use currently anywhere on the campus. So we've been following that policy since the beginning of the academic term, intend to continue that policy. So I'm not sure what you mean by non-official university events.
Hi, Chancellor. I'm sorry, just to clarify really quick. What I mean by that, in an unofficial capacity, obviously no official university events will be happening.
Yeah.
But if a group of students got together, had a tailgate, had a group event, and the university heard this information, would there be any repercussions? Would anything be enforced with that?
Absolutely. Yes, absolutely. In the same way that we're not allowing that to happen currently. I'll give you an example of the reverse of that, we had an event on campus this past week on Tuesday evening that was sponsored by our Minority Student Athlete Coalition, a rally that they had that was explicitly planned with distancing and with protective mechanisms in place. We approved that and they followed that, and it was done well. Something like that, well, official university event, certainly, but if there was an event that was impromptu, that was outside of those guidelines, that was on the campus, absolutely, we would be enforcing that that would not occur. Make sense, Ashley?
Sorry, yes, thank you for that. I'm just curious, what would that look like being enforced? Would the students just ask to be dispersed, or would they receive any on-campus repercussions?
Both.
And what would those repercussions be?
If there's a violation of our student code of conduct, which includes endangering the well-being of others, it would be put into our student code of conduct process. And that's been made to our student body since coming back to the beginning of the academic term.
Chancellor, this is Bill with 1011. Do you know if the student athletes have been allowed to return to practice or if there's a timetable for that?
So the football athletes have had some lower level of practice, non-contact practice for a specified number of hours that already was approved by the conference previously. So they have been having that level of practice through recent weeks. That next level of practice will not go into place until the testing protocols are in place on all of the campuses. And we anticipate that would be no later than September the 30th.
Thank you.
And Chancellor Andrew from Channel 7 again, while you're still up there, what is the capacity that you have for isolation and quarantine right now, both on the main campus as well as on East Campus?
Yes, Andrew, we have a quarantine facility on campus that's dedicated, one of our residence halls that is fully dedicated for that purpose. It has about 180 full occupancy. It has never exceeded about a third full through the course of the first 5 weeks of the semester. So we have a lot of capacity there available. And we do, with the assistance of the Lincoln Lancaster County Health Department, we have procured additional off-campus quarantine facilities in a local hotel for needs if it arises, which we've not had yet. So that give you the answer you're looking for. We have significant quarantine facilities available, but so far have had relatively low utilization of them.
Questions?
Mayor Riley with the Journal-Star. The new DHM extends the mask mandate to the end of October. Do you foresee with that timing that the mask mandate will continue likely into 2021 locally, considering that we'll be in flu season?
I mean, it's hard to answer that kind of a question without a crystal ball, Riley. It is, throughout this pandemic, we've been saying how the situation is dynamic, things evolve rapidly. But we're sending all our love and support to the scientists and the companies that are researching at warp speed to develop a vaccine, because of course we know that is one of our best chances at getting through and past this pandemic. And as long as we have rates of transmission and positivity rate and all the indicators we use to determine the dial, as long as those are providing levels of concern, and like you said, with flu season coming up, we are likely to see the utilization of masks being a foundational tool, because we know how effective they are. They are so effective in stopping the spread, even if just you're with people and only one of you is wearing them, but even better if 2 people together are wearing them. So based on the science, based on the evidence we're seeing in our community, we continue to encourage people to wear masks in order to protect themselves and their loved ones.
Mayor, I know we have a few weeks until Halloween, but there is a section of that DHM that talks about door-to-door sales. Would that impact trick-or-treating, or what kind of thoughts have been given to whether that will be allowed in Lancaster County?
You know, it's funny. I'm just tell you a quick story, Bill. When I first became mayor, I went to lunch with Mayor Sang, Mayor Wesley, and Mayor Beitler and talked about their experiences. And I asked them, what's your best advice for me? And they each gave me some, and Mayor Wesley said, well, you know, my best advice came from Mayor Johans. And he said, don't cancel Halloween. That advice has been haunting me throughout the pandemic. I want to do everything I can to make this possible for the children of our community, but we got to do it safely. And I do believe there's been some consideration of that with our DHMs. I would ask if Scott could speak to that briefly.
So Bill, typically there's a very specific concept of peddling and sales, and as far as I know, I've never been asked to buy anything from a trick-or-treater. So I think that we're going to be allowing Halloween, and as Mayor said, we're going to figure out how to guide people safely on that, and we're not concerned about the DHM. So.
Thank you.
Any other ones? All right, well, thank you so much for joining us today. Thank you for joining all those who are being heroes in our community by wearing masks and watching their distance, washing their hands, avoiding large gatherings, and protecting family, friends, and neighbors from COVID-19. Your concern and your care and your compassion are going to help us get through this together. Thank you.